CEREC Connect, the world's largest digital dental network, allows dentists to create a digital impression, send it to a laboratory that has incorporated the Sirona in-lab system, and the restoration is fabricated and shipped back to the dental office.
My name's Thomas Grimes. I've been practicing dentistry for 20 years in Matthews, North Carolina. I've been using CEREC technology for 14 years. Today we will be preparing a bridge for my patient from tooth number 13 to tooth number 15. We will be using the CEREC Connect technology to fabricate a zirconium bridge.
First, a shade is taken of the neighboring teeth to establish the necessary color and value of the new CEREC Connect restorations. The teeth are then prepared. Sirona OptiSpray is applied to enhance the quality of the digital impressions. With the CEREC Connect software open, you can add the patient information to the computer database and begin capturing the digital impressions of the preparations, the opposing dentition, and a bite registration using the CEREC BlueCam. The digital impression improves patient comfort because they will not be subjected to the potential discomfort of conventional impression trays. With CEREC Connect, a digital impression can be immediately reviewed for quality on screen while the patient is still in the chair. The preparation margins are marked, and the CEREC Connect prescription form is ready to be accessed. An online prescription form is filled out with the patient's age, teeth numbers, indication, material type, preparation shade, and desired restoration shade. Once the prescription data is entered, you can add additional information or extraoral photos, and then select the lab that you want to use, along with the desired return date and even time, and then add the prescription to the cart. For final submission to the laboratory, you will have to electronically sign the prescription with your license number and password. Upon submission of the case to the laboratory, the lab receives an email notification indicating that a new CEREC Connect case has been delivered. The new case can be accessed directly from the in-lab software via CEREC Connect for review of the restoration data and prescription notes. Unlike conventional impressions, digital impressions do not require infection control, but can move straight into production. A work ticket of the prescription information can be printed out and will accompany the case throughout the laboratory. Upon acceptance of the case, a physical model can be ordered from Infinident, and the lab can begin fabricating the zirconium oxide framework for the bridge. In the meantime, Infinident will start fabricating the models using the latest rapid manufacturing technology. Unlike conventional models that are subject to dimensional changes from impressions and stone, digital models are dimensionally stable and are an exact representation of the situation in the patient's mouth. The model is received back from Infinident, and the dental technician can start building porcelain and finish the case to the CEREC Connect model. Digitally fabricated CEREC Connect models enable the laboratory to fabricate any type of restoration that was previously only possible through conventional impressions and models, such as PFMs, zirconium oxide bridges, or gold crowns. Back in the office, the restoration arrives on the date you selected during the online transaction, and you are now able to seat the restoration.
We just finished our bridge using the CEREC Connect technology. It was a good experience. I was amazed at the fit of the restoration. And then, it dawned on me that for the first time we actually made a bridge to the teeth rather than to a model of the teeth. I had virtually no adjustment to the bridge. So I'm very pleased with the outcome of the bridge, and I look forward to using this technology again, and I think it represents the forefront and the future of our profession.